Dr. Rodgers, how are you?
Doing great.
I want you to meet my partner, Dr. Pericottle, as well.
Hello, how you doing?
We're in the RV right now, and we're just roaming around. I have no clue where we are, but I'm so glad that we were able to get in touch with you and get you on our to talk about a little bit about what you do and a little bit about men's health and how it's related to your practice. So you were mentioning you're a podiatrist, a foot and ankle surgeon, and you do a lot of you try to prevent amputations. So when you mention amputations, what exactly are you amputating?
So it's something as small as a toe, but as much as part of the foot or the whole foot, and in some cases patients lose their whole leg below or above the knee.
Okay. And so what are some of the risk factors for these things?
The number one risk factor is diabetic neuropathy. So people that have diabetes, and then after 8 to 12 years, even with really good care, but most commonly with not so good control, they develop neuropathy, which is a loss of feeling in their feet. And this loss of feeling for the audience is really is predisposes you to trauma in your feet. So just think about if you weren't able to feel your hand any longer and you touched a hot stove. That pain is a warning sign for you to draw my hand from that hot stove so I don't get tissue damage. When you lose feeling in your feet and you're walking around in a mall or wherever, walking around the street, you know how typically like you or I would walk around and occasionally you may be wearing a bad pair of shoes or you just have a callus on your foot and it's a little painful. Well, subconsciously you change the way that you walk and you don't even have to think about it. It's just, you put more pressure on one side of your foot or the other side of your foot. But people with diabetes that have lost this gift of pain, as it's called, they take the exact same step every time, don't have the feeling of pain, develops into a big blister. That blister opens up, turns into a foot ulcer, and that's a break in the skin. And your skin is there for a reason. It keeps the good stuff on the inside and the bad stuff on the outside. Once you have that break in the skin, it becomes a portal of entry for bacteria and some other problems with diabetes, like circulation problems, can prevent that from healing.
So you were saying usually you see this 10 or 12 years after someone's been diagnosed, but or is it something that we can see sooner if the diabetes is not managed appropriately?
Well, it's typically about in the diagnosis of diabetes, it's typically about 8 to 12 years after the diagnosis. It could sometimes people present with a foot ulcer or neuropathy as the presenting symptom of diabetes. They go to the doctor for the very first time, and men are actually pretty bad about this. As you know, and I'm sure that this is a lot of what you cover on your show, but it's trying to get men to not be so macho sometimes, and to go see a doctor when they need to see a doctor.
Yeah, and men overall, do you see more men in your practice with these problems, or would you say equivalent men and women?
Well, I see younger men in the practice, and that's because younger men typically are. When I say younger, we think about the population of type 2 diabetes. It's typically getting younger now anyway, right? But more younger people are obese, have insulin resistance, and so it's instead of being in what we used to call old age diabetes or adult onset diabetes, this is happening a lot younger now, even in high school kids, type 2 diabetes. But if you take men and women, men will typically have foot complications before women do because they may be working. Maybe they're a construction worker, they're on their feet a lot. So this is you typically see it in men earlier.
Interesting. So we understand, controlling diabetes and, that could prevent a lot of these things, but obviously that's not always possible. So what are some things that you do in your office, to help these patients that get these ulcers? And my whole goal is to scare them. So you can be as gruesome as you want with some of the things that you've seen.
Well, there's primary prevention and secondary prevention. Primary prevention is before an ulcer even occurs, what are we doing? That's just what you mentioned, how to prevent diabetes from turning into bad complications. Even go further, how before that step, even how to prevent diabetes. So that's primary prevention. Secondary prevention is when there's a problem that happens, then they come see me. We specialize in secondary prevention. So we see people that come in with usually with a big infection in their foot. And oftentimes it's, I mean, I remember distinct cases, I'm sure as you do too from your practice, but I remember on a Christmas Eve one time, a patient comes in and because the family said, "Dad, your foot smells so bad, we can't have you around on Christmas Eve. You got to go to the hospital," and came in with a festering infection and an abscess, gangrene, and we weren't able to save his foot because it just had gone on too long. Now, the interesting thing is that in diabetes, there's also a suppression of your immune system. Just like, I try to tell patients it's similar to HIV, where the immune system is suppressed. Diabetes, because of the high blood sugar, it suppresses the white blood cells, and so they don't mount as big of a response to an infection. And these infections can travel rapidly. So you can take somebody with a foot ulcer that gets an infection, and in a matter of days, they're losing their leg at the operating room.
Wow.
So that's why it's so important to act as fast as possible.
Oh, wow. That's crazy. So what are these? So you mentioned some immunotherapy things now. We actually use some stuff that kind of gets the immune system revved up in there. I think you guys use that stuff as well, right?
Well, we can use CGSF actually, and it's that's one way to boost the immune system. And there's been a couple of studies about preventing amputations, but there's not. We haven't done any studies on other, aside from antibiotics and incision and drainage and other things, on preventing amputations from boosting the immune system in response to an infection. Although this is certainly a population that requires it.
Now, what about using things like AmnioFix and stuff? When would you use that?
So we typically use Epifix, which is the version that. It's same company, MiMedx in Atlanta, Georgia. They create this tissue made out of placenta and the amniotic tissue, and we can use it not really for infection. This is the important thing is having a stepwise approach to somebody that comes in almost about to lose their leg, and then you go through this process and you get them to the point where you have a nice, clean, healthy wound. And you need to get this wound healed. I mean, no man or woman wants to be hanging around forever with a wound that's not healing. I mean, you truly feel like, what's wrong with my body that this thing can't heal? It's a break in your skin. When you're younger, these things just heal. And so what we have to do is we have to put growth factors on them. And the great thing about Epifix is that it contains about 80 different proteins and growth factors. It helps to kind of like charge the body so that it can heal the wound a lot faster. So we use this frequently in the operating room and in the clinic. It's been a big help to our practice.
Wow, so that's fantastic. So in terms of how long do some of these things take to heal?
I'll just give you the estimate. If you just follow the standard of care, of care in 12 weeks, only 30% of them are healed. That's
12 weeks?
12 weeks.
Oh my God.
So that's why we use things like Epifix and other treatments in order to make that happen a lot faster. It really takes a toll on not only the patient. Thinking about 12 weeks, I mean, these people are going 16, 20 weeks, sometimes a year before this thing heals.
Wow.
Imagine changing your life for an entire year. That may have effect on your job, definitely on your family. You may not feel if you have had surgery, so this is why it's so important to come in as early as possible. Wow,
that's intense. So, so top 3 things that you want to tell men out there right now about their health. Like it can be about your specialty or just in general to kind of get them motivated. Number 1.
Yeah, so I think that, and being a man, I know this is true. You tend to seek help later because you're always, your whole life things things have just gotten better, right? You go through your life and hey, if I just wait a little bit longer, I'm sure this will go away. And most of the time, that happens. But when you're dealing with diabetes, it's no joke. And diabetes makes any other disease 10 times worse. Anything you get, whether, like you said, erectile dysfunction oftentimes will bring somebody into the doctor's office because that impairs their other activities. And so that's a good key to start treating the other complications of diabetes and preventing them. So that's number one for men, just in general, with our psychology. Number two, let's with diabetic foot ulcers, the one of the most important things we can do is to change the footwear that people are wearing, so that it takes the pressure off of certain spots on their feet. And you need an exam to have that happen. And so we can get back to work, we can get back to play, all the things that you want to do, but all you have to do is get the footwear changed so that we take pressure off certain areas, and that will keep us from ulcerating. And then number three is, I think, really is diet. And it's hard. I know you I mean, I can just tell from seeing you travel a lot, just like I do. It's drinking your water, doing all this stuff, but it's hard to maintain. When I say diet, I don't mean like calorie restriction or anything like that. I just mean like living a healthy lifestyle and eating a good diet. It's hard. And especially if you're a man and you're at work, if you do a lot of tough work, you're going to have higher calorie requirements. But maybe you have a more sedentary job, like a lot of other people nowadays, and it's hard to eat healthy in that environment. So that's why it's important to read magazines, to get information, good advice from dietitian, and adjust your lifestyle for the rest of your life.
Well, that's fantastic. Well, thank you so much for joining us today. And we'll be in LA actually late tonight if we make it. And then we'll be at USC tomorrow. I think it's 2 to 4. So if you're free, just come on by if you're in town. Otherwise, we really appreciate you taking the time out of your busy schedule to talk to us and talk to all of our men today. And you can always follow us on driveformentalhealth.com. We're very close to finishing our 6,000-mile journey, thank God. And we're so happy that you were part of that journey with us. So thank you, Dr. Rodgers.
Hey, thanks, and keep up the good work.
Thank you, buddy. We'll see you, man. Thank you.
Okay, bye.
Of course we're happy, man. We're always happy. All right. No. You're gonna speak in the singular.